Do you have fibromyalgia or a vitamin D deficiency? Fibromyalgia and vitamin D deficiencies are very often exactly identical symptoms. Large numbers of people have been misdiagnosed with fibromyalgia when they simply have a vitamin D deficiency. Don't be one of them. I'm Dr. Mark Dailey. I am a doctor of chiropractic and a certified functional medicine practitioner. Now, if you have fibromyalgia, chronic fatigue, or any other type of pain, no matter what the cause, you might actually be suffering simply from a vitamin D deficiency. The symptoms experienced are so similar, it is absolutely critical that you get your vitamin D level checked and corrected so that you're in the optimal range. Enough people have experienced significant and even complete resolution of their symptoms of fibromyalgia that you just simply cannot skip this test or this step. It's actually a fairly inexpensive test to get done. Your doctor can do it, or you can even send off to a laboratory. Don't make the mistake of thinking that you get enough vitamin D already, that you can't possibly be deficient. You might be shocked to find out how low your level is. In fact, one study that tested the vitamin D levels of fibromyalgia patients found the average level was a severe deficiency of 15 nanograms per milliliter. Let me just say that it should be somewhere between 70 to 100. They were at 15. That is dangerous. Unfortunately, they came to the conclusion that fibromyalgia itself causes the vitamin D deficiency, instead of thinking that vitamin D deficiency causes the symptoms of fibromyalgia. There's also a pain connection. The pain that's experienced from vitamin D deficiency is due to a condition called osteomalacia. Osteomalacia is nearly identical to osteoporosis, except it's painful. And remember, osteoporosis is thinning or demineralization of the bones. It's the main reason that vitamin D and pain are so related. The pain that occurs in osteomalacia is significant because, like fibromyalgia, it occurs when pressure is applied to the skin. In fact, one of the general ways you can determine if you have osteomalacia is to press your thumb down hard on your sternum, the bone in the center of your chest. If this causes pain, it's likely due to osteomalacia. In osteomalacia, the pain is often described as bone pain and can be felt all over the whole body. But all over muscle pain is termed myalgia, and connective tissue pain is called fibralgia. Pain that can be experienced as fibromyalgia trigger points is also experienced by those with osteomalacia and those with fibromyalgia. A couple of other similarities are generally both are unresponsive to medications, unresponsive to antidepressants, and occur with disabling weakness and vitamin D deficiency fatigue. The profound fatigue experienced by those with fibromyalgia is identical to the fatigue reported by people in studies of vitamin D deficiency. It's just another strong connection between vitamin D deficiency and fibromyalgia. Myopathy is experienced weakness or weakness in the muscles and is almost universal with a fibromyalgia patient and diagnosis. There is also a very, very real connection between the gut and fibromyalgia that cannot be ignored. Hippocrates was known as the father of modern medicine, and he said all disease starts in the gut. And I have found that to be true in my 10 years of experience working with fibromyalgia patients. I offer a course showing how every symptom of fibromyalgia can either directly or indirectly be connected to poor gut function. Take a look at the course overview below. I hope this information serves you well. God bless you, and I wish you the very best of health.